Welcome to Real People, Real Voices. I'm your host, James Jackson.
I'm your co-host, Pastor Wayne Moore.
Always a pleasure to host with you.
It is. Brand new year.
Shaping up to be a great one.
It is. The Lord is blessing, and we have some interesting things going on this year. We have somebody here very special that's going to talk with us today.
Yes.
About the flu epidemic that is running through Indiana. We have our state commissioner with us today. Dr. Box is with us today, and I think that is a great opportunity for us to introduce her to the community.
Yeah, she's going to make a very passionate appeal.
Right.
For people to get their flu shots, and people might think it's too late.
No, it's
but
not.
She's going to let us know.
No.
She's going to let us know for sure.
And I tell you what, I think she's going to also tell us about the statistics from last year. Mm-hmm. And they were pretty rough last year. And so we're going to try to do everything to inform the community that it's never too late to get a flu shot, especially between October, November, December, January, February, even in March.
Yeah, I got mine.
I got mine. I've been doing well. Hadn't had a cold yet. Let me knock on wood. But yeah, we had a great time. We're having a great time here on Real People, Real Voices, man. And you know what? I haven't said it, but I enjoy working with you, man.
Likewise.
I enjoy working with this family here, and we're having a great time. We're gonna have a great year.
Yeah. And before we go to break, I want to thank our sponsors.
Yeah, Lee Casso in Crawley, who's been with us for almost 2 years now. And Fervent Care Christian Academy has been with us since the inception of the program. And we're so happy that they're still with us. And if you want to be a part of Real People, Real Voices, let us know. Give us a call here at the station, and we'll make sure your sponsorship gets A1 service.
Yeah, ask for Curtis.
Yes, ask for Curtis Baker. He'll make sure it happens. He'll make sure it happens.
Absolutely. We got a lot to share with you on today, so stay tuned. We'll be back after this. Welcome back to Real People, Real Voices, and we're joined by Dr. Christina Box, the State Health Commissioner.
Yes.
Sir.
Welcome to the show.
Oh, thank you for having me, Dr. Moore and Pastor Jackson. I can't tell you how much I appreciate
We're happy to have
this
you.
opportunity.
Yeah, we're happy to have you.
So what is your responsibility? I know we have the title State Health Commissioner, but what does the commissioner do?
So really the Health Commissioner leads an agency of close to 900 individuals that is really charged with protecting the health of the Hoosiers in the state of Indiana and also preventing trauma and injury. So it is anything from diabetes or chronic diseases like asthma to hepatitis A outbreaks in the state to emergency preparedness in case, God forbid, there would be a tornado or some other type of emergency to maternal child health, addressing our infant mortality rate and addressing what we can do to make a difference in maternal mortality. So it's very varied. I am an obstetrician gynecologist for 30 years prior to this, so I come with a very narrow background, but have learned a tremendous amount in this past year.
Experience will teach you as you go along. Won't it?
Absolutely, and I've had amazing teachers at the State Department of Health. There are some amazing individuals who work there. I've been very impressed about their dedication and their heart that they have for public health.
So what do you hope to accomplish during your tenure?
Well, really, it would be amazing. I know many people have asked me that, and I'm sure they say, well, bring down the infant mortality rate and prove that, and that obviously is my heart. But honestly, if we could stop talking a little bit less about specific disease processes and start talking more about living healthy, about how we can get up every day and have the best body that God intends for us to have, and going forward being able to get those steps and exercise in and eat more healthily and just protect that one body that God gave us to do whatever His mission for us in life is.
So the symptoms, we talk about the disease and the symptoms more than we talk about the front end of it, which would be protecting our health, eating the right thing.
How can we prevent?
Yeah.
Right?
Yeah. That's a good point.
Talking about prevention, a lot of people contract the flu across the nation. How are we doing in Indiana? And tell us what we need to do to make sure that we stay safe.
That's awesome. You know, this year, thankfully, we've had a little bit slower start to flu season as compared to last year, but last year was really horrible.
It was.
At this point last year, we had already had 25 individuals lose their life to influenza, and we'd already had outbreaks in 25 of our long-term care facilities. This year, unfortunately, we have lost 3 individuals already to influenza, but we've had no long-term care facility outbreaks or school outbreaks yet. It started a little bit later this year, which I think has been helpful. And it looks like our vaccine is probably matching a little bit better with the strains that are running around at this point in time. So it is never too late, as you gentlemen said earlier. If I say that once, I'd like to say that multiple times today to get your flu shot.
I went to my primary care provider for one thing, and it appears that every time you go now, they offer you a flu shot. They didn't used to do that.
Usually any time from October through May, if you haven't had your flu shot, that is one of our top priorities. It's really an important part of prevention. So when you see your family doctor, your internal medicine doctor, your pediatrician, they're definitely going to look at preventative maintenance for you, and the flu shot is a big part of that.
Yeah, pneumonia shots and flu shots. Those are the 2
Absolutely.
priority shots that they want you to have every year, and you need to do that. How many did we lose in 2018 to the
I think there was
influenza?
336 individuals that lost their life.
In our state?
In our state.
Almost 350 people.
Yeah. So
Wow.
it was a really, really long and horrible season. And, you know, unfortunately, we lost a lot of children with that too. And those individuals that are age 65 and older are at risk. When we look at people that are at risk, it's particularly our young children, less than the age of 5, especially less than 2. We look at pregnant women as also being at very high risk. And the awesome thing is if we immunize those pregnant women, not only will they help to protect themselves during pregnancy, but they also will make antibodies that then pass to their baby before it's born to protect the baby when it's born, because we can't immunize infants under the age of 6 months.
And antibiotics just doesn't do it for the
No,
flu.
it's a virus, and antibiotics, just like the common cold, are really not very helpful. Now, sometimes you can get a secondary bacterial infection like a pneumonia after you've been so sick with influenza.
Dr. Box, a lot of people may be thinking, well, I don't need a flu shot. We're having some unbelievable weather. Is weather a factor, or is this something that's going to happen nonetheless?
We're going to see more of an outbreak. Even though we've had a slower start, by the end of December, we were already at high activity across the entire state of Indiana. So we'll see that pick up more and more. And the flu shot, you know, as I mentioned, those high-risk populations, those people that are immune suppressed, cancer patients, pregnant patients, the very young, the very old, but also getting a flu shot, even when you're a young, healthy person, helps to protect those individuals in your home or those individuals that you come into contact with that may not be able to get a flu shot or may be at higher risk. People with chronic diseases like diabetes, high blood pressure, congestive heart failure, people that have lung diseases like asthma or have been smokers for a long time are particularly at risk.
Dr. Box, do you remember in the school system many years ago, they gave us flu shots?
Yes,
do you remember
sir.
that?
Yes, sir.
Does those programs still exist in IPS and in other schools as
There
well?
are some schools throughout the state that do get a lot of their immunizations. For instance, the local health department will go and do immunizations at the school. And a part of that kind of stopped because if you're not a VFC provider for a youngster, you don't not a Medicaid provider, you don't cover private insurance, then there's only certain people that you can immunize.
So bureaucracy cut that out.
Yes, in a way. And quite honestly, we're working to see if we can't make that easier for individuals to go into school systems, because as parents, you know, with the after-school activities that kids have, and we're all working, we're very busy, so it is difficult to get children in sometimes. We want everyone to have a medical home, a physician, a family doctor, a pediatrician, internist that they see, but a lot of immunizations are being given now by our pharmacists in pharmacies across the state, which is another good option.
Yeah, it's outstanding.
And not only influenza, but the infant mortality rate has begun to skyrocket again. What are some of the things we can do at the grassroots level? Our church is getting ready to do a workshop on infant mortality rate, but how can we make or put it to other situations or other organizations to where we can get the word out to where people can understand that it's on the uprise and that we almost have a high percentage, more so than the country here in Indiana.
And that is one of the reasons that I felt so strongly about taking this position when it was offered to me, because after 30 years of private practice in obstetrics, it was very depressing to see our infant mortality rate in Indiana still be so high. We have basically 7.5 infant deaths per 1,000 live births in 2016. But the really good news is that that rate did go down in 2017 to 7.3. We saw a significant decline in white and Hispanic infant mortality, but unfortunately our Black infant mortality went up. And so that disparity there continues to be an issue. So the programs that we're designing and the resources that we're deploying, we're trying to definitely make sure that we're addressing those high-risk populations.
Define infant mortality rate for our viewers.
So infant mortality is the death of a baby before his or her first birthday. So you need to be born and then live for that first year of life. So it's not just about getting that healthy baby into the world. It's following that child, making sure the child is getting the pediatric care that it needs, that it's sleeping safe. And so when you talk about your church doing things, we'd love to partner with you and give you some ideas about things that you could use for educational tools within the church with regards to infant mortality. Safe sleep is a big one that a lot of churches do.
It is big, and that's going to be one of the things we're going to concentrate on is safe sleep.
So let's stick a pin in it right there. We got to take a quick break.
Sounds great.
We'll be back after this. Welcome back, and we're joined by Dr. Christina Box of the state. She's State Health Commissioner for Indiana. We are enjoying all the information that you're sharing with us, try to keep us all healthy. Overall, is Indiana a healthy state?
Actually, no, and that's part of the reason we have issues with things like infant mortality, because we always say healthy moms make healthy babies. Indiana is currently the 12th most obese state in the nation. We were the 10th most obese state, and I wish I could say it was because we lost weight, but actually we just didn't gain weight as fast as a couple of other states. So obesity leads to things like diabetes and high blood pressure, which leads to our #1 cause of death in the state, which is cardiovascular disease or heart attacks for both men and women. And the diabetes is a significant risk factor also, along with high blood pressure, for stroke. So that definitely contributes. We also are the 8th highest smoking state in the nation, and smoking contributes to heart disease, contributes to stroke, contributes to lung cancer and lung disease, and significantly increases infant mortality. So it's all tied together.
So what is the state doing to help people who perhaps have financial challenges with getting care? Healthcare is an issue in America. It's kind of difficult for a lot of middle-class folk to get proper care and preventative care a lot of times.
Let alone poor folk.
Yeah. So what is the, and I say middle class because a lot of poorer people will be able to get the Medicaid and some of the free care.
Right.
But you got the folks in the middle a lot of times who have to pay their own and can't get it. So what is the state doing to try to make things more affordable for everybody across the board?
Well, what we have seen, unfortunately, is that a lot of people, even that have insurance, have such high deductibles that they are kind of essentially functionally uninsured, right? Because to meet that $8,000 deductible or $5,000 deductible is so out of reach that they don't end up getting their preventative care that they need to get. I know that Dr. Walthaw at FSSA has worked very hard to try to make sure that that gap between when you are able to qualify for Medicaid and if you get that job and you start earning some money, then all of a sudden you don't have enough to pay your health care or you don't have health care. So how can we kind of prevent that cliff there? How can we support individuals with health care insurance or Medicaid going further by expanding HIP and other programs to make sure that they do have coverage? For instance, with hepatitis A, we've been doing whatever we can to get out free vaccine to any agency, any local health department, any hospital that will use it to make sure that those people that do fall through the cracks.
We had a severe breakout in 18 with that.
Yes, we have, and we have been surrounded by it too. Ohio, Kentucky, Michigan have had much more significant outbreaks, but we normally see about 20 cases a year. We've seen over 800 already this year. So it is a significant problem, and unfortunately, it hits populations that are homeless. It hits populations, individuals that use IV drugs, people that are poor economically, as you're discussing. So they don't have the ability to clean their hands as well and to be able to not share that from person to person. So we're trying to make sure that we're immunizing those at-risk populations.
Tell us what you're doing with the opioid situation.
So the opioid situation is a chronic disease, as you know, and once individuals get hooked on that, it's not easy to get them off of those medication. It's a chronic disease where it will relapse and then it will get better, they'll get into recovery and then may relapse again. So the important thing is making sure that we, number one, educate and prevent the stigma that's associated with that so that people do understand that this is a chronic disease, to make sure that individuals who are willing to get into care have the ability to get that care and that care is close to home. So FSSA, where the Department of Mental Health and Addiction lies, has been making sure that they're expanding programs across the state. We're training more of our physicians, whether they're obstetricians or family doctors or internal medicine doctors, to actually give medication-assisted therapy, and then training more social workers and mental health workers so that you can also get that counseling and therapy that goes along with that, because we know that mental health impacts so many aspects of our health, our physical health.
And to be truthful about it, there was a misnomer. It was only happening in the white community.
Absolutely.
But now it's at least 25% in the Afro-American community, which is a rise within just a 2-year period of time. We're hoping, I'm hoping that what's done in rural areas can be done in the inner cities as well, because it's becoming an epidemic, whether we realize it or not, because it's a rough situation for all communities, and then not to have what it needs to try to fix that is devastating.
And it's right now, you know, it's opioids or the use of opioids, but we also see it mixed in with cocaine. We also see other issues with other medications. So we really worked very hard to make sure that all of our coroners are reporting a consistent tox panel so that we know what individuals are dying of in our state, and we can address that in different regional areas of the state and make sure that we have the appropriate resources there.
Right.
Well, Dr. Box, we're just about out of time, but I do want to ask you, across the nation, we don't have as many psychiatric beds as we used to have many, many years ago. You would think we'd be, as a nation, further ahead on this issue of making sure that people who are dealing with mental health illness would have some place to go. And as we know, the Marion County Jail is the largest
mental health hospital.
Is that something that's on your plate or on your radar?
Absolutely. The Department of Mental Health and Addiction actually lies at FSSA, but you know, we're, as agencies, we just kind of melt together, basically. We work very closely with our partners there, with Dr. Walthall and her team. And the realization, as Dr. Walthall and I looked at it, that many, many health factors have a diagnosis also in the mental health field, so that they overlap so much. And a lot of what we're seeing is kind of co-locating that physical health with the family doctor, the internal medicine doctor, the OBGYN, along with the mental health at the same time, and maybe even an addictionologist, is what has really been successful. So we're working to try to build more programs that way. But we really kind of got short with our workforce development. We needed more social and mental health workers to be available.
Yeah, I heard that there's a shortage in those areas.
Absolutely.
Yeah.
And before we let you go off it, when we were transitioning the show, we had someone cough, and you went into I
got on them. I said the 3 C's. You need to definitely cough, cover your cough. Wash your hands very frequently, and if you're sick, I sincerely appreciate the fact you're dedicated and want to come to work or school, but please stay home. Contain yourself at home until you're better.
You heard it here from the commissioner.
the State Health Commissioner. And to your point with containment, what type of recourse or what type of defense do people have if they don't have a doctor's note, but they're trying to contain themselves and make sure that the thing doesn't spread?
You know, I've never really considered that before, but if you've actually gone and received care someplace, whether that's an emergency room or someplace else, just a simple statement that you were there and were diagnosed with influenza or diagnosed with pneumonia or whatever it is, should suffice for your workplace or your school.
Yeah. Well, thank you.
Thank you so much for having me today.
We're going to have you back.
All right, I'll look forward to that. Thank you.
And thank you all for being with us. We hope that you enjoyed the program so far. You have the rundown. We'll be back after this. Welcome back to Real People, Real Voices. I'm your host, James Jackson.
I'm your co-host, Pastor Wayne Moore.
And I'm your executive producer, Faith McKinney.
We're having a great time here.
Yeah.
And let's thank our sponsors.
Yeah, Lee Koslick and Crawley, who's been with us for almost 2 years now. And then we have the Fervent Care Christian Academy, where we can get our young people started on the right direction and the right pathway.
Yeah, give them a call at 317-898-2751. And let me mention this because we haven't done
Okay.
this in the past couple of years. Your church,
Yeah, I don't talk much about it.
Olivet,
I love it, man. I love it.
Olivet Church.
Yeah.
Out there on
High School Road. Yeah.
Where I grew up.
Yeah, Olivet is one of the oldest churches in the city of Indianapolis. It's out on High School Road. We welcome, it's a lovely, warm church. And if you happen to be on the west side of Indianapolis and don't have a place of worship, we'd love to have you become part of the Olivet Church family.
Yeah. And certainly want to thank the folks over at Fervent Prayer Church, 10512 East 38th Street. And your church is 50?
4141.
41.
High School Road.
High School Road. So go to church, go to worship.
Yeah.
Faith?
Yes.
She's clenching her teeth over here. We're going to get back to talking about what we're talking about.
Put me on the spot.
No, I'm not going to do that. We talk about the flu, and primarily Dr. Box was here to talk about that. We talked about a lot of other things. A lot of people don't want the flu shot because they say it gives you the flu.
A lot of people may have some symptoms afterwards, but I've heard and experienced that if you don't have the shot, the flu is much, much, much worse.
Mm-hmm.
You think you're dying.
Yeah.
And many people do die. So,
We lost over close to 350 people in 18.
that's a lot.
It's a lot of people in Indiana. It's a lot of people.
Yeah. So I don't think people
Understand the seriousness of it?
understand the seriousness of it or should believe some of the things like that. I guess there might be people that get it, but as you said, not necessarily by the shot, but that shouldn't be the reason why people don't protect themselves.
No, and there are other ways to protect yourself as well as getting the shot. If you're sick, please stay home from work. Don't come and spread whatever you have with everyone else. That is irresponsible. But getting your shot, making sure you're physically healthy, taking your vitamins, eating well, all of those things that we know we're supposed to do.
Yeah, which can be a challenge nowadays.
It's going to be a challenge for all of us. I mean, because we do like good food, and we like a lot of us have remarkable taste buds, so we like good food. But health is important,
Yeah.
and
it's
one way
priceless.
to keep colds off of us was an old thing Mom did. Always give your children vitamin C.
Yeah.
Yeah, take your vitamin C.
Take it now. We'll see you next week.